Patients should always know their individual cardiac risk when they're talking to a doctor. The more strikes you have against you in terms of your risk, the higher the likelihood that you will have a cardiac event, and that then translates into our need to use a statin to lower that risk. Patients can be empowered to know their numbers. They can know what their blood pressure is, they can know what their weight is, they can know what their family history is, they can know what their cholesterol levels are. The more you know about your own individual risk, the more empowered you can be to change those risks or modify those risks. For example, you can stop smoking, you can lose weight, you can have a more active lifestyle, but you can't change your genetics. If a patient understands that going into a doctor visit, it's much more effective for that doctor and patient to have a discussion about whether it is appropriate to start a statin, and if it is appropriate to start a statin, what dose of that statin would be the best dose for that particular patient. It can always be overwhelming for patients when they are prescribed a new medication. I always say to patients, the most important thing is that before you take a medication, you need to understand what the medication is being used for and why you need to take it, and also what the potential side effects are of those medications, so that you know what types of things to look for and you know what types of things to report back to your healthcare team if you're running into any trouble. And that way doctors can know to adjust the medication accordingly, or maybe to switch you to a different type of medication that can accomplish the same thing. Millions and millions of patients take statins and you would never know. And the reason why is because they are generally so well tolerated and you're not going to run into any major side effects. And if you do, you can always talk to your doctor about it and things can be adjusted.